Okay, so good morning. My name is Dr. Patricia Ganz, and I am here to welcome you officially from the National Cancer Policy Forum of the Institute of Medicine. This is a forum of the IOM that has been in existence for about 10 years now, and it is made up of a diverse set of stakeholders who meet to discuss issues related to cancer policy, and we have at least 3 workshops a year, and these workshops usually emanate from a policy meeting that we have every 3 or 4 years, where stakeholders come to us with ideas about issues that should be discussed. Unlike Institute of Medicine consensus studies, or IOM reports, which you may be familiar with, these workshops are actually more informal undertakings where we have a planning committee that's actually developed the agenda and invited the speakers, and each of them will be speaking today, and there will be a workshop report that you all have access to, which will be an edited summary of what has been said, but this does not have the policy implications of an IOM consensus study, which usually takes place over about an 18-month period of time. However, it's very important that during the course of our discussion in the next day and a half, that you participate, and there are microphones in the room, and we would like you to come up to the microphone and speak and ask questions. There are going to be many times during the day and a half where there will be open discussion. Please identify yourself. The meeting is recorded. It's live on a webinar that's being broadcast. And identify yourself when you come to the microphone and ask questions, because what you contribute to the discussion today will be included in the workshop report. And as I said, while this does not have the policy strength of an IOM consensus study, these workshops do often move the needle on a lot of topics. So before I just end here, I also wanted to thank the American Cancer Society. They are members of the National Cancer Policy Forum, and this particular workshop is really something that they instigated and came to us with, and really have played a very important role in putting forward. And to speak to this, I'd like to introduce Dr. Otis Brawley, who will speak from the ACS about this workshop. Thanks.
Thank you, Dr. Ganz. I'd like to thank the National Cancer Policy Forum. I'd like to thank the members of the Workshop Planning Committee, acknowledge the strong work of IOM staff Cheryl Nass and Sarah Therikin, and ACS staff Rebecca Kirsch for your efforts in putting this important workshop together. We at the ACS understand very well the necessity of the conversation that will happen here over the next several days, and the strategic implementation steps and research programs and advocacy that will take place in follow-up. Childhood cancer is an area of oncology that's seen remarkable progress as well as incredible challenges. While survival rates for some pediatric cancers present a stunning success story, far too many types of pediatric cancers still we aren't successful in treating. The ACS Facts and Figures special section published last year featured detailed childhood cancer statistics, laying out a helpful benchmark for quantifying the progress and challenges that have led us to this workshop today. But setting aside the statistics, when we're speaking of cancer or any other serious illness affecting kids, even one diagnosis or death is one too many. Moreover, even in cases where cancer is considered curable, the consequences of treatment present significant long-term challenges for children, their families, their communities, and our health systems. I very well remember a paper published just several years ago that suggested nearly half of childhood survivors have at least 5 comorbid conditions to deal with for the rest of their life. Together with all of you, the American Cancer Society is committed to helping make quality of life for children and families a priority of research and clinical care as an integral part of disease-directed treatment. We know our job is not done until all families facing the unthinkable receive optimal care that supports cure and quality of life, so they have the opportunity to both survive and thrive. Again, thank you for joining us today, whether you're live here in the room or viewing us via webcast. I'm looking forward to the presentations and discussions, and pledge to all of you that the ACS stands ready to help in partnership with stakeholders. And again, I want to acknowledge my many friends and colleagues. Dr. Pizzo, it's been 27 years since we started working together. Thank you, and I look forward to today and tomorrow's discussions. Dr. Wolf? It's my pleasure to introduce Dr. Joanne Wolf.
Thank you, Otis. And wow, I am so overwhelmed and excited and thrilled to be here. I, too, want to thank the American Cancer Society and the force behind ACS, Rebecca Kirch, for making this happen, as well as the National Cancer Policy Forum and Sarah and Cheryl Noss for their incredible work in getting us here today and to where we hope to be beyond just today. I also want to thank the members of the Workshop Planning Committee. It has been a true pleasure working with everyone, and for me it's just amazing, representative of bringing everyone together under this roof of comprehensive care for children with cancer. I mean, let's just take a second and think about the title of this workshop: Comprehensive Care for Children with Cancer and Their Families. It's really a momentous coming together of passionate family members, highly dedicated clinician investigators, and advocates who not only strive for every child with cancer to be cured, which is absolutely the top priority, but for the child and family to have every opportunity at restorative care throughout the illness course and beyond, for quality of life to be at as important as everything else that we do for these children and families. I'm speaking to you as both a pediatric oncologist and a palliative care practitioner. And this workshop has particular meaning because it brings together the sort of disciplines that don't often sit together under one roof to think about our shared challenges, objectives, and steps forward. We do have a comprehensive and ambitious agenda for which we hope that everybody stays on time, Dr. Riemann. Focused on identifying action steps needed to improve quality of life and quality of care for children and their families. And I'm convinced that the outcomes of this workshop will truly make a difference, and it's up to all of us to join together to move this work forward. This is a workshop that truly represents interdisciplinary and person-centered care. And I'm also struck by the superb timing of this workshop. It happened in sort of good timing related to the IOM's recent report on dying in America, which focused on the quality of palliative care and end-of-life care for patients along the life spectrum. And I think that this will complement that report with a particular emphasis on the needs of children. The report's recommendations for early integration of palliative and psychosocial care with disease-directed treatment apply for any age and any disease stage. Of course, as my mantra holds, not just at end of life, but throughout the illness course and well beyond for surviving members, surviving children and surviving family members. There's also an incredible public interest in quality of life now. We know that, for example, Atul Gawande's book, Being Mortal, has been on the bestsellers list for weeks and months on end, and you just have to listen to him speak to know that what he has to say resonates with the American public, and that's a great opportunity for us as we bring forth the needs of children. There's national advocacy efforts to enhance the quality of life agenda through public policy, and they're getting good traction and need more, supported by an organized Parent Quality of Life Coalition and legislative campaign. So, over the next day and a half, we'll build on these bodies of work and craft a framework for research and optimal care objectives and actions specific to improving quality of life for children with cancer and their families. Just as we expect, families want, and hope for, we've built our agenda to address the continuity of care across the entire continuum. We'll start the day just this morning with an overview of the pediatric cancer landscape. We'll focus on quality of life priorities in research and in the research and developmental pipeline, and then optimizing clinical care and care transitions. Continuing in tomorrow's session, we'll dive into more specific opportunities for patient and family engagement in research and, importantly, outcomes reporting, as well as opportunities for documenting and using these data. Now pay attention. This is where you come in. We've built time for every session's presentation to hear brief perspectives from family members. Thank you so much for being here and supporting this effort, and for group discussion. So I want to emphasize the importance of audience participation. What you share today will form a part of the robust outcome of this workshop and the reports that will follow all that we intend to action on. So, without further ado, on behalf of the Planning Committee, I thank you all for being here. I hope, I intend for the time that you've invested here, together with everybody else, to make a real difference in the lives of children and their families. I'm so looking forward to working with you over the next day and a half and beyond. And so we'll get to the heart of the matter, dive right in. I'll turn the workshop over to the esteemed Dr. Phil Pizzo and colleagues to get us started. Thank you so much.